And we have a few other people joining us. So again, thank you everyone for joining us today. We're excited to have you guys here and talk to you guys about our medical office professions program. And Professor Alexander, you can see my screen okay, correct?
Yes, I can.
Perfect. All right, well, let's get started. Professor Alexander and Professor Holliday, next slide is with you.
First of all, I would like to thank everyone for taking time out of your schedule to attend this program. It is with great appreciation that you all are here. And what we want to talk about is a new modification that we're proposing for Southwestern and to put together for our medical assisting program. As you all know, under the medical assisting program, it's actually three components. You have a medical assistant clinical, administrative, but you also have this coding and insurance billing certification that's there as well. So there are three different career paths within the program. And in many instances, when you hear of coding and insurance billing, you think of clerical things. Well, it's anything except clerical. It's more of health information management. You're actually managing informations for many different providers. And what we're proposing with our program is that you're able to receive a medical coding certificate, specialist certificate of achievement in preparation for you sitting the national coding exam. So that's the number one. I can't, could someone handle the slides? It's not allowing me to move forward. It's not allowing me to do it. Okay.
So I'll go ahead and move the slides for you so you can just say next or however
okay,
you.
Great, yeah. I will. Thank you. So for those of you that are interested in this path, career path, or for those of you that are on this career path, whether you're interested in the front office, back office, the financial components of it, medical coding, is going to outlive most of the other professions that are out there in this particular program. This is an awesome stepping stone for if you're interested in perhaps moving into nursing, into management, into compliance. There's positions that work with the medical examiner's office, medical records. It's just a wide array of different opportunities that are available in the coding and billing with health information management. So let's look at this career path a little bit better so you can see how the success path can go in many different ways. Next slide, please. What the proposed certificate will look like is this. The first semester is going to be the medical terminology because that's the foundation of the course. Then we're going to have human structures and functions, which is really anatomy and physiology, things of that sort. Legal aspects of healthcare. We want you to have a solid foundation as you move into the course, and then pathophysiology. The second semester is going to introduce you to health information management from the perspective of all the different things that are involved in it. We're going to also continue on building that foundation and your knowledge base because we're going to have the pharmacology there as well. Then you're going to actually move into the coding component of it with CPT. Now, CPT stands for current procedural terminology, and we have that within the semester. However, when we get to the ICD coding, which is the medical necessity for the visit, we're proposing to put that into two parts because it's a huge conglomerate of information that has to be managed. So we're proposing breaking that into two parts. You'll take part one in semester two and part two in semester three. And this will give you all the coding guidelines, all the foundations and things that are going to be required for you to code accurately. Also, in your third semester, you're going to be taking medical office procedures. This is where you're going to get that knowledge base of all the Microsoft products. You're going to get your PowerPoint, your Excel, your Word, foundation tools that you're going to need to be successful in the career. Then you're going to also have a course of principles of leadership, because when you're working in health information management, you're not sitting behind a desk and it's just not clerical. You're working with all facets of healthcare team members, physicians. You're going to be working with attorneys, sometimes presenting information to them. You can become an expert witness in many instances once you have your certification. In one of our panelists area, he's actually an integrity officer for his particular position. So there's a wide array of avenues and pathways that you can take. And the leadership helps you to really be able to hone those skills and be able to adapt them into many different directions. Then you have healthcare reimbursement, because if you're going to be abstracting and taking the codes out, is for the purpose of many of the facilities getting reimbursed, as well as the physicians being reimbursed. And in semester 4, we've reserved that for your practicum. This is where you're going to take all of the information that you've learned in the other 3 semesters and be able to apply it to a practicum, where you're going to be actually having medical documents that you're going to be reading and taking the codes from, putting information together, making presentations and things of that sort, to really take those skills and put them to use so that you're confident and you're comfortable when you enter into this particular career, or as you prepare for your certification. Next slide, please. So let's talk a little bit about what medical coding is. Medical coding is the transformation of healthcare diagnoses and procedures for medical services and equipment, and you translate this information into alphanumeric codes. Computers read numbers. They don't read a whole bunch of words. So we have to translate everything into alphanumerical code so that the computer can read it. So the diagnosis and the procedures that you're going to be translating come from medical record documentation, such as the transcription of the the physician notes, laboratory and radiology reports. And as you continue to develop your skills, that you, as medical coding professionals, you ensure that the codes are applied correctly during the billing process. And again, this includes the abstracting of the information from the documentation, assigning the appropriate codes, and at the end result, creating the claim to be paid by the insurance carrier. Next slide, please. And as we continue to evolve with this particular career, medical coders, as we stated earlier, they translate all this documentation into standardized codes that provides information such as the patient's diagnosis, the medical necessity for the treatment of the or for the services and supplies that they're receiving, and any unusual circumstances of any medical condition that might affect those treatment of services that they're receiving as well. And also working with the coroner's office in reports and death certificates. And think about that for a moment. You know, we always think about life experiences, but there's a lot of experience that goes on after a person passes away as well. There's still codes that take place in that area too, because our ICD-10 codes actually are used for statistical data, because they can help us to determine in particular geographical areas the types of diseases that are more prevalent. So for instance, in Nevada, we might have more kidney failure, whereas in Texas, we might have more heart failure, and in California, it might be more cancer. And I'm just using those as examples, but because we translate written documentation into codes, we can have the computer run all these statistical reports for us as well. So it gives us an array of information. Next slide, please. So this brings us to the area of why this field is growing at such a rate that it's growing, and it includes a number of factors. We have an aging population. In order to have the current research and development, we need to know what kind of research and development to pursue. We have an increased focus on healthcare data and information. Everything is going electronic. And then we have the digitalization of health records. And I just want to stop for a minute here and just bring everyone's attention to something, because last year when COVID-19 hit the airwaves, we had no codes for COVID-19. We had no information for that. We all became totally aware of it in March, By the end of March, beginning of April, we had codes that had been created that we were working with COVID-19. We had guidelines that were in place. So coding is something that's constantly evolving. And as circumstances change, more research is done, they continue to develop codes, medical codes. Next slide, please. So the best specialists that possess the best qualities of coding specialists are these: your analytical skills, being detail oriented, maintaining your integrity, interpersonal skills, and technical skills. And when we talk about these skills, these are all skills that can be developed with a motivation and attention to detail. You have to be able to accept the challenge. Coding is not something that you walk in the office, someone gives you a document and you read it and say, okay, I'm just going to pick these codes. There are guidelines that go along with it. It's a very dynamic and evolving field, but these type of skills are very important qualities to develop as you consider going into this direction. Then when we think about, next slide, please, as we think about how this specialty represents a dynamic career path, whereas you as students are a vital part of this allied health profession by statistics related to geographic disease prevalence, as I said, about the different diseases, the continued reimbursement for medical services. Every year when Congress decides how to affect the Medicare fee schedule, or if they're going to do a reduction here, the codes play a very important part in that development. Then we have compliance management of medical information. When we think about HIPAA, when you go into a medical office, your medical information, how your medical record is maintained and managed, all that's a part of coding and health information. Expert witnesses, we're all seeing how trials are playing out on television. More and more medical information is being utilized in these areas. So you can see how codes play a very prominent role in this particular area. Next slide, please. So when we start to think about coding and its significance, every time you see a physician, that healthcare provider does the following things for you. When you sit down in his office, the first thing you tell him, I'm here today because I have upper right quadrant pain in my abdomen. He's going to say to you, or she's going to say to you, how long have you had it? Do you have any type of family history that relates to this? And then after, based on the information that you're giving them, they're going to make an expert assessment about what's wrong with you. And remember, it's called practicing medicine. So they're going to make an assessment based on the information you're giving them as to how to treat you or how to treat your current illness or your injury. And then all of this is documented as a visit. The documentation for the patient, this is an ongoing record. Your health record is always evolving every time you go in to see a healthcare provider. And technology now has allowed us actually have access to our medical record by multiple providers, which makes the healthcare we receive a lot more cohesive and better for us. So as we continue to move forward with healthcare, coding and health information is going to play a very vital role. So it brings us to the job market. So let's think about the job market. Next slide, please. According to the Bureau of Labor Statistics, the medical billing and coding field is expected to grow by 15% between now and 2024. Now, we're only talking 2 years, really 2.5 years probably. So that's almost 30,000 job openings within the next 4 years. Not only are these jobs in just coding and billing, they're lucrative and they offer an array of different possibilities. Coders work for insurance companies. Coders work for, as I've said, coroner's offices, hospitals, physicians. There's an array of different jobs that coders work for. So I just want to bring that to the forefront. So let's talk a little bit about salary since we're talking on this level. The entry level for level for coders as a entry level for salary for a coder in 2019 was $42,630. Now that's about $20.50 an hour. But across the US, the top 10% of coders make over $72,000 a year annually, depending on your locale. And this graph here from the labor statistic wasn't a graph that shows at the 90th percentile. So we actually can see that this field is a very prominent and lucrative field. And not only can you use it in the office, you can take it and do webinars. We see how many healthcare webinars are out there. Compliance for credentialing. It is just a wide array of business opportunities that are available for you as you continue to move through coding. The next area we're going to talk about is the administrative medical assistant. And I'm going to defer to Professor Holliday if she would like to present this particular portion of our presentation.
Yeah, I wasn't going to spend much time on it because we really want to focus on the coding and billing. But part of that program is learning skills that are going to help you in the medical office. And so it's a good start while you're waiting to take your exam, network with other coders to see what's out there. It's a great start to have a job and some stability while you're reaching for your ultimate goal. And again, these statistics, I think, are based on 2019 salaries, but most organizations or hospitals really start more toward the 50th percentile. So UCSD entry level is almost, is a little over $35,000. And then of course you get a benefits package. So it's a great field just to get started in while you're waiting to take your exam and to be able to network. So I want Velma to go ahead and finish up because really want to talk more about the coding and billing. Next slide.
And I just want to add a component to the administrative part. You can leave that slide there, Luciania. But even when you're in coding, you have to put together presentations to state, because your physicians are going to ask you, how many patients did I treat last year that had congestive heart failure? How many of that related to something else? And when you can utilize the administrative portion of your skills, such as putting together PowerPoint presentations and Excel charts and graphs, it makes you more marketable. So the more that you bring into the table, the more benefits that are going to come to you. But when you speak of the clinical, see, we told you it's 3 components. We've talked about the coding and billing component. We've mentioned the administrative component. And just to round it out, we have to talk about the clinical medical assistant. When you walk into a physician's office, the first person you meet more than likely is going to be that administrative medical assistant. She's going to be at the front desk answering calls, or she's going to be perhaps in another area of the office doing authorizations and referrals and things of that sort, scheduling surgeries. But then you have the clinical medical assistant. That's going to be the person that comes out, calls you by your name, takes you into the examining room, does all the vitals and everything, and prepares you to see the physician. And even with that, a newly certified medical assistant in the clinical aspect of it is still at the 50th percentile, making $32,000, and at the 90th percentile, $45,000. But again, these are all careers that are pathways into bigger careers and larger opportunities. So some people really don't like working with people. So maybe they don't want to be a clinical medical assistant, but they would like the pathway to nursing because they're interested in offering educational opportunities. Because just because you're a nurse doesn't mean you have to do patient care. You could be a case manager. So there's so many different avenues that these careers can lead you into, and they're very good careers. Actually, add this point to it. When COVID hit last year, lots of people were laid off in many different fields. However, within the area of coding, billing, and medical assistance, they maintain their positions in the office. Maybe the office trimmed down on the medical assisting a little bit, but the coder had to continue working because whatever the doctor did had to be coded to transmit out. Same thing with hospitals. They were overflowing with coding opportunities in hospitals because they were filled. So this helps you to appreciate that these areas are areas that are evolving and they're very career oriented. Okay, the next slide, please, Yesenia. Here we're going to talk about pathways to success. We know that every student has their own pathway to a successful career. The information we've presented is from the allied health professionals component of that. And everyone in this particular area, professionals, employers, and educators, in order to have a clear career path, it takes knowledge and research. And we're advocates for allied health professionals. We hope you can use the information that will help you navigate your own career path and reach your own individual goals. But one thing we can tell you with the next slide, please, is that you choose your own direction. And the only direction is up. If you always think positive and apply it, the only direction you can go is up. And again, I want to thank you, and we're going to have time for questions as we go forward. Okay, Yesenia.
Perfect. Thank you, Professor Alexander. So now, how do we get started? That was a great presentation, a lot of great information. So if you want to pursue the medical office professions program, any of the three that were mentioned today, the very first thing that you got to do, of course, is complete your Southwestern College application. So our application is done through this portal called CCC Apply. So when you are submitting your application, you are going to create an account for CCC Apply, and then you're going to submit your Southwestern College application. So not until you see like the picture that I have on the screen where it has all those tabs on the left-hand side, that's how you know you're going through the Southwestern College application. If you do not see all of those tabs, then you are not there yet. It's not complete. So in order to register for these classes and start your program, it's important to complete your Southwestern College application. And I will go over how you can get assistance with this as well. For our high school students that are graduating this year and are planning to attend Southwestern College in the fall as a full-time student, you do get to participate in our early admissions program. So this is specifically for graduating high school seniors. And the good thing about this program is that you receive priority registration for your first fall semester. So definitely it's a good way to get off on the right foot during your first semester at Southwestern College, because with priority registration, you're going to get the classes that you want and the schedule that you want, because classes do fill up quickly. So all you would have to do is complete your application and complete your new student online orientation by the end of May. So we have about a month here to complete that so you can receive priority registration. We do have application support sessions every Wednesday. So we will be having a support session on the 28th this week. So definitely sign up for that by going to tinyurl.com/SWC app support. We'll go through the full application with you, and if you have any questions, we'll be able to answer your questions right then and there. We will be having 2 more sessions in May, the 5th and the 12th. And then we will open up some more application support sessions for summer. However, we don't have the schedule for that just yet. But again, you want to complete your application and new student online orientation before the end of May to receive priority registration. Lastly, you can always chat with one of our peer ambassadors via our outreach lobby. So we have two ways that you can communicate. We have one through Cranium, where you see this little snippet on the right-hand side, it will ask you to log in. You don't have to be a student. You can use your Gmail account or Facebook account, or you can even create a guest account to use our Cranium lobby and chat with a peer ambassador. Or we also have a Zoom lobby. So if you go to our webpage, swccb.edu/outreach, you will see the Cranium lobby and the Zoom lobby button where you can speak with a peer ambassador and get assistance with your application. Lastly,
Excuse me, Yesenia?
Yes.
Excuse me, someone has a question. Martha, can you explain what your question is? Martha Reyes.
So if you're referring to paying for classes, you do have to pay the tuition fees. However, there are financial aid options available, which we can definitely review some of the financial aid options at the end as well. Okay. I also invite you guys to follow us on social media. That's where we post a lot of our event updates when we have application sessions. That way you can get assistance, or if you have any questions, you're up to date. So definitely follow us on social media as well. Okay. So now we're going to go ahead and move to our panel discussion. We will go ahead and answer your questions at the end. So just a reminder, feel free to put your questions in the chat for the panelists. These are current students. We have Luisa, Danya, and Mirela, and then we have Mickey, who is a former student. So I do want to allow for them to introduce themselves. So let me just move my screen here a bit. So I'm going to have them just introduce yourselves and let us know who you are and how many semesters you have been at Southwestern College. Luisa, you're first on my screen. Do you want to start?
Sure. Hi, I'm Louisa Bond, and I've been at Southwestern College for 6 semesters, but this is my 3rd semester in the Billing and Coding program.
Thank you. Danya, do you want to go ahead and go?
Yes, hi, I'm Danya Williams, and I've been at Southwestern College a little over a year, but I'm into my 2nd semester of the Billing and Coding.
Perfect. Thank you, Danya. Mirela?
Hello, my name is Mirela Lopez. I'm in my 5th semester in Southwestern College, but my 4th semester in the Billing and Coding program.
Perfect, thank you. And Mickey, I think let me unmute you here.
Hello, can you hear me?
Yes.
Oh, okay. All right, my name is Mickey Fields. I completed the program and the Billing and Coding program from Southwestern in 2010, that spring. And I sat for my certification that August of 2010, and I passed on the first try.
Nice. And Mickey, where are you currently working right now, and what is your job title?
Okay. Currently, I'm in New York State, and I'm in the city of Rochester. I work for Rochester Regional Health System. It is the 2nd largest employer in the area. It consists of 9 hospitals, multiple primary sites, specialty sites. The push in this area was to take medical services out to the community. So it's a large system. And my role in it is Physician Coding Integrity Coordinator. CICs are expert, the subject expert. And what we do is we are resources for the providers, coders, practice managers, and also ancillary staff. If anyone have any questions concerning coding, documentation. We're there to help them out, and we handle the entire system. On a daily basis, my responsibilities are I have my specialties are allergy, rheumatology, immunology, pain medicine, pain management, and infusion. I also oversee the infusion center. So on a daily basis, I will go into a claims edit work queue, and every charge that's in there is a charge that has some issue with it that couldn't be corrected. So it's my job to go in and find out what's wrong with it, correct it, and send it on to billing. And I also have a responsibility in that same area for any and all denials. Denials are kind of like waves; they continually come. So it's one of those things where you continually work in denials and trying to get them out. And we try not to miss the filing deadlines on. Sometimes that's almost impossible. But it's a very challenging job. It's a very rewarding job. And I could not think of anything else I would want to do for that. And I want to say one other thing too that Professor Alexander brought up. When the COVID pandemic hit, it from a coding standpoint and a reimbursement standpoint, it caught everyone off guard, and it was a very dynamic situation, and things were changing on a daily basis. Payers were denying charges. We moved to telehealth services, which not all payers were paying. Mm-hmm. And each payer wanted something different, and it was a very dynamic situation. It was exhilarating from the standpoint that you're trying to get the system reimbursed. So during that time, it was just a very dynamic situation. It was an exciting time. Mm-hmm. But now things have calmed down quite a bit. So.
Yeah. Yes, they have. Thank you, Mickey. Yeah.
Thank you for sharing that, Mickey, and we look forward to hearing more about, your position. And why don't we just start off with you, Mickey? You're in the job, but what made you want to study medical assisting and more specifically medical coding?
Well, myself?
Yes.
I was always interested in medicine. I just didn't know how to channel that as far as not going to med school and everything. So a friend of mine had introduced me to medical coding. I did some study on it and decided to try and take a course at it. And once I started, it was so interesting that I just dove right into it. And one of the most challenging things I remember in taking the course was understanding evaluation and management. And it was one of those things that it was just hard to get your head around. But that's one of the things I specialize in now is E&M coding.
Nice, perfect. Danya, what made you want to pursue medical assisting?
I was kind of like Mickey. I've always been interested in medical. So it was either the medical field or law enforcement. And I couldn't choose between the two for the longest time. But then after a while, I was like, well, I saw just how lucrative and challenging and interesting the medical field was. So it was something that I figured, well, it just kind of, I guess, a calling. It kind of called to me a little bit. So when I started looking into it, started seeing, I knew I didn't want to do the clinical part, but I wanted to be able to help people in some way. So when I saw the administrative part, I was like, oh, that sounds pretty good. I had kind of had the experience working in office settings and stuff. So I was like, well, that's great. And to learn something new, and then to kind of make it more specific into the billing and coding and seeing just how rewarding and technical and detail oriented, which are a lot of things I enjoy doing. I was hooked and I applied and here I am.
Nice. I like that you had that calling. Mirella, what made you want to study medical assisting?
So my first semester of college, I was very confused as to what my major would be. And I had a friend who said, you should try the medical assisting program. I graduated, I found a good job through the program. And I wasn't sure if medical the medical field was something for me, but within the first semester, I saw that medical assisting is really the base of the whole medical field and clinics, billing and coding too. And it was just something that attracted me right away. And I'm glad I continued that.
Nice, that's awesome. And I think a lot of students are in in the same situation where they just don't know. But I definitely encourage everyone to, do your research and browse, the different types of programs and careers that are out there. Luisa, what made you want to study medical assisting?
Well, I wanted to study billing and coding and medical assisting because I wanted to have a career in the medical field that didn't necessarily require me to go to school for a really long time. And I also like the pay and the room for growth in this field.
That's awesome. That's definitely one thing to consider for sure. So what has been the most challenging experience that you guys have faced when starting or going through your program? Mickey, you want to go ahead and start with that? What was the most challenging thing that you went through when you were going through the program?
Well, like I said, it was the E&M portion of it was the toughest part for me. It was just hard to get an understanding of it. And with Professor Alexander's help and guiding us at that time and focusing on just doing the 3 key components and stuff, we kind of put stuff together. But I really didn't get a good grasp of it until I actually had a position in it and working, and then I got a really good understanding of it. But that for the entire course, that was the toughest part for me.
But you got through it, so that's good. Daniel, what has been the most challenging thing for you so far?
I would have to say the most challenging thing, first of all, having to go back to school after all these years. I graduated years ago, and of course I started into the workforce, and I worked in the education field for 2 years. So I worked in an office setting. I worked in the human resources office and kind of did all the latest stuff that you learn about under the medical assisting program. But what was really challenging was when I stepped away from that job and decided I was going to go back to school, you kind of have to turn yourself off to what you know, the experiences and everything that you've learned from working and being in the office setting under one field. You kind of have to turn that off and realize it by starting new, it is completely new. And even though you may have the basics behind what working in an office is about, such as customer service, answering the phone, things like that, it's not necessarily the same. And having to turn off my experiences and everything I thought I knew, and open myself up to something new and be completely vulnerable to learning what comes with being in the medical field and stuff. That's what's been challenging, because you really want to jump in and to do that when in fact, no, you kind of don't. So to have to turn that off and really just realize you have the experience, but you don't have it the way you're supposed to, is what's really challenging. Just turn it off and starting new.
Right. It definitely is scary, switching careers. But I'm sure you have found something rewarding as far as the things that you're learning.
Absolutely.
You say that's correct? Yeah.
Correct.
Thank you. Mirella, what has been challenging for you thus far?
So far, I relate a lot to Mickey. When we reach coding, E&M was very difficult to begin with, but luckily there was a lot of information in the program that helped set it up. It's just a matter of when you just begin, the guidelines and all the large set of coding can seem a little overwhelming, especially when you're not sure how to differentiate what book is what code and where in the report you need to code. But it's rewarding as you go on in the program to learn each part of it.
Perfect. How did you overcome that challenge of, that difficulty and essentially learning, the coding and the E&M? Is that how you say it?
It was a lot thanks to the professor. She took a lot, Professor Alexander took a lot of time and resources to help us understand. It was a lot of learning the basics first, learning your guidelines, what each guideline is trying to tell you to do, and remembering to always, if you need help, rely on those guidelines and go back to your basics before trying to start the actual report coding.
Right. And I think, one thing that we can take away from here is that our faculty are very dedicated to their students and are willing to assist them, with anything that they may need throughout the program. So
Yeah, could I just interject one thing, because everyone's hearing E&M. So I want to just tell you what an E&M code is. It's an office visit. When you go into your doctor's office, we briefly talked about, you go in, you have a chief complaint, he does the history evaluation. Well, all that's broken down into different levels of coding depending on what your particular situation is. But it's something that you have to wrap your arms around in order to get, but it's really office visits. And believe me, they're the most widely used codes in medicine, just to give everyone an idea of that. All specialties use them, and they're very widely used. But when you come into my class, I'll be more than happy to help you learn that too. Okay.
Thank you, Professor Alexander. Luisa, what has been your most challenging experience?
The most challenging experience that I have faced in this program is definitely transitioning from the classroom environment to at-home online instruction when the pandemic hit. I remember when I first received my ICD-10 and CPT coding books, I was really intimidated by how huge they were and the information contained in them. Initially, it was kind of difficult to navigate the manuals without being in the classroom physically with the instructor.
I definitely understand that. I speak to a lot of students, and with COVID and doing online instruction, it's definitely not something that they were looking forward to. So just to let everyone know, as far as remote instruction, our summer session will be online or remote, and we will possibly be going back in the fall. They haven't given us too many details as far as what that will look like. Is it only staff? Is it students? But just know that there might be that possibility that we will be on campus. But if we're not, then it'll still be online remote learning. Luisa, what did you do to overcome that challenge and kind of adjust and adapt to that new environment?
Well, with the professor's help and support, and as time progressed, I was able to gain a better understanding of how to more correctly use the manuals and how to code accurately.
Perfect. That's awesome. You see, faculty dedicated, dedicated faculty. Mirella, you are in your externship. You're doing the externship, right? So how has the program prepared you to do that?
Well, in the semester where we were actually learning the codes and how to use our manuals, Professor Alexander gave us a lot of sources, and she said, remember to save them. You're gonna need them in the future. They're gonna be very useful. And now I have my whole folder of sources opened up, ready, and it gave me a very wide understanding of what the externship would include. It helped me to see how to differentiate both systems, where, like I said, learning the basics helped to become more detailed in my reporting. So now there's slight things that I read something and I'm not sure about. I know I need to go back to my guidelines and rely on the information I learned in the program to make sure I can select the correct codes.
Right. When I do a lot of career education presentations, and I always tell students that through our career education programs, which this is one of them, you get that hands-on experience. So you're ready to, when you go out into the workforce, you're ready to do that job. That's exactly what Mirela is doing, right? She's learning how to do it, getting that experience so she is ready. And when those employers are looking at her resume, when she's doing those interviews, they see, okay, Mirela knows how to do X, Y, and Z, what we're looking for, and you're more likely to get hired. So this is what I love about my job and the career education programs, is that I really get to say, like, dedicated faculty, hands-on experience, what you need to get a job. So that's awesome. Mickey, I know you talked a little bit about this, but tell us again about how did the program prepare you for the certification, and then your current employment where you're working at.
Okay. When I went through the program, Professor Alexander, she's best reading the guidelines, and for both CPT and the ICD-10, the diagnostic code. The guidelines are very important. The test is all about the guidelines. If you familiarize yourself with the guidelines, you should be okay with the certification test. And also, from the classroom to actually getting a position and getting into the workforce, inexperienced coders are going to struggle. That's just the nature of the business. But if you have a good basics of coding and understanding how to use your modifiers, sequencing your modifiers, you're going to do a lot better. And that's what I got from this course. I was prepared to do the basic stuff. And with training, with on-the-job training, I came up to speed a lot faster. I've heard managers complain about coders that they hired that were inexperienced and didn't have an understanding of basic coding. And Professor Alexander, she definitely prepares you for that. You definitely have the basics for it, and it's a huge step to get into your first position. And you have that basics, and the transition is going to be a lot easier. It's just I really thank her for preparing me for that.
That's awesome. That's awesome. Good success story right there. So I do want to open up to questions. I think there was some questions in the chat. So I have one here. Are the credits of the classes transferable? So maybe to Professor Alexander or Professor Holiday.
Credits in the class, what we're talking about in this particular program is career education. So you can transfer our classes over to Mesa College here in the San Diego area, because they also have a bachelor's program in health information management that prepares you for to sit the exam for CCS, or you can go on with your bachelor's and become a registered health information administrator, RHIT. And when you talk about an RHI, am I saying that correctly, Pam, or is it an RHIA? Professor, am I saying that correctly?
RHIA for the bachelor's, Velma.
Okay, to the bachelor's. But anyway, our program, our credits are transferable there if that's the direction you want to continue in. That's another career path. However, what the program really is geared toward more than anything else is helping you be successful for the certification. Once you obtain your certification and become a coder, you act what career path you would like to continue on, and then you can gear your further education toward that. So I hope that answers your question sufficiently. I wasn't trying to.
I think that Martha had the question and she was unable to unmute herself, so maybe she can explain it a little bit.
That one was actually from Eduardo, but Martha does have a question.
Yeah,
how many
okay.
semesters are there in the coding program?
There are 3 full semesters that take you to the final semester, which is the practicum.
Or the fourth
Everything that
semester.
you're getting in the other 3 semesters prepare you for the practicum. And within the slides, we did go down toward each semester. Your first semester, we focus on your medical terminology, your anatomy and physiology, your pathophysiology, because while you're not doctors, you need to be able to read the medical terms and understand the information as it's presented. Then we introduce you to the legal aspects of healthcare. With any career, there's always a legal part to it. Then in the second semester, you go to your introduction to health information management. You're going to also take your pharmacology, and you start to do your CPT coding and your ICD coding. Third semester, you're doing your medical office procedures. You're continuing on with your ICD coding. And the reason ICD coding is broken into 2 semesters is because originally, when we were with ICD-9, we had about 20,000 codes. When we moved to ICD-10, we now have over 70,000 medical codes. And we code to the highest level of specificity. And this is where the bulk of your guidelines are. They're going to be within your ICD coding. There are guidelines in CPT, but you have more within the ICD portion of the program. Then you have principles of leadership, healthcare reimbursement, because all the codes feed into a channel so that the payer can pay for the services that were rendered. And then in your final semester, that's your healthcare practicum. That's where you're going to take all this information and you're going to take a whole semester and you're going to have an opportunity to apply the knowledge.
Thank you, Professor Alexander. And I did put it up. I did share the screen so people can take a look at it again. And then Martha does have additional questions. So
Yes.
I'm going to go ahead and.
Okay, let me kick my dog out.
Okay.
My question
He's
was,
gone.
I took a few classes at the adult school, and I wanted to know what the difference was, because here I just wanted to see some of them charged and some of them didn't. So that's kind of where I was trying to understand what the difference was. And that's why I asked, do the classes have a cost? And you mentioned, yes, each class has a cost per unit.
Yes,
and you mentioned there are programs that will pay for it.
Yes, so tuition is $46 per unit. However, if you're taking classes at the adult schools, we do have classes that are articulated with Southwestern College. So essentially, whatever class you took at the adult school for free, you can earn college credit at Southwestern College. And that's sort of a separate process. You have to submit everything through our CAPMA system. And then once we verify that you have completed the course, your instructor at the adult school will put the grade for you in our system. And from there, we will add it to your Southwestern College transcript. And I can go ahead and provide my email address in the chat for you. That way I can help you with that process. We are working on doing workshops for students to get that completed. So I can give you more information. So what will happen is if you do get those courses articulated, let's say it's the MEDOP 230, that's for this first semester that they're suggesting. Essentially, if you did that at the adult school, you already have that very first course completed. So you only have to worry about the additional 3. So if you take the additional 3 courses at Southwestern College, that is what you would have to pay for in regards to tuition. But we do have, you can apply for FAFSA that provides grants. We have the California College Promise Grant that waives your tuition fees if you qualify. So those 2 are based off of your income and your family size. And that's actually the only 2 that we have. We also have the Southwestern College Promise. So if you don't have any other college experience previous, you can apply for that as well, but you do have to be a full-time student in order to receive that. And that gives you 2 years of free tuition if you do not qualify for FAFSA or the CCPG.
Yes, Cynthia, we have one of our professors, Pam Nagy, is also an adult. She teaches at the adult school.
Oh, perfect.
So I don't know, Pam, do you have anything to add to that, Pam?
As far as financial aid and such, No, but
Articulate,
I will say
articulating.
that we do offer quite a few courses that are articulated with Southwestern College. So it really does give you a first step and make an easier transition to begin a program over at Southwestern. So if you want to check with your instructor to see if your course is articulated, it's definitely something that's an advantage for you. And you probably, if you're in the medical courses, are taking something right now that's articulated with Southwestern.
Perfect, thank you. We do have, I'm sorry, go ahead.
Lisa also had a question, Yesenia.
Yes, so that's what I was gonna do next. So
Okay.
if a student wants to start during the summer, what classes should they start with?
Well, that's semester 1. You have to take these courses in order. So you can't take something from semester 1 and then pick something from semester 2. So you have to complete whatever is in each semester before you can move on to the next. So in the summer, we offer medical terminology online, and we offer, and I'm not sure if there's right now, if there's going to be any other offering in this area.
Perfect. So the medical terminology class then. Perfect.
Yes, MEDOP 230.
Perfect. Does anyone have any questions? You can go ahead and put it in the chat, either for our professors or for our students. If you guys want to know from, that student experience, what is it like, at Southwestern College for these classes, or if you're interested more about, the work in medical coding, we do have Nikki that is working in the field. So you can go ahead and put it in the chat, or you can raise your hand. I will do my best to see if you have your hand raised, and I will go ahead and unmute you. In the meantime, I do have a question for our current students. What a lot of our students here are prospective students. They might not have applied, or this is going to be their first semester. What advice do you have for new incoming students?
I would like to add something. It's very good to take your summer semester, if you will take a summer semester, to fill up your general education courses, because as you can see, you do have to take maybe 3 or 4 courses per semester during the program. So summer semesters are very convenient to take those general education. And also everyone and all the staff members of the medical assisting program are very attentive of their emails, their phone numbers. If there's ever a question, they will always be ready to answer within 48 hours. So it's, I would just recommend not being afraid to ask any questions. Ask more questions if they're interested.
Thank you for that, Mirela. And I think that's definitely something important to know. When you're in high school, you have the counselors right there, and they're often telling you, you have to do this, you have to do that, maybe sometimes even in the adult schools. But when you're at Southwestern College, it is important to advocate for yourself and open that communication. So reaching out to your instructors, reaching out to other resources that we have on campus to really, help you is important. So thank you for bringing that up, Mirela. I do have another question in the chat here. Are there any requirements for medical terminology? So maybe like a prerequisite.
Velma?
No, there is no requirements for medical terminology. It is an entry-level medical terminology class. Your emphasis on actually constructing and deconstructing words, a real emphasis on your prefixes and suffixes and your root terms. And this is what I would like to say about medical terminology. When you take your medical terminology course, it's something you're going to be continuing with the entire time you're in the medical assisting program. You won't take medical terminology, pass it, and leave it. It's something that you're going to be building on on and continuing to use. So my advice to a new student is to really establish a good routine. Don't overload your schedule to the point that you don't allow for study time, because we are at a fast-paced course. We're giving you a lot of information, lots of assignments. It requires lots of reading. So when you're structuring your schedule, allow time for you to study and to really think about what you're reading so that you're able to take that information and use it, because a lot of the information you're going to be using right away. We're building on this information constantly. And I do agree with Ms. Lopez when she says, use your summers and your winter sessions, if there are classes offered, to take those general ed courses. Because when you're in the program courses, those courses are building on one another and they're constantly moving you forward.
So your general ed courses are going to apply to your 2-year associate's degree. So that would be good to take those in the summer.
Mm-hmm.
I mean, and in between the semesters.
Perfect, thank you. We do have another question. If we're taking classes at the adult school, do we have to take classes at Southwestern College, or are they equivalent? So this goes back to similar to earlier. If you are taking a class at the adult school that may be equivalent to one of these classes, then they would be articulated with us. But again, like one of the other professors said, you want to check with your instructor in the class that you're taking to see if that course is articulated. And then they can give you more information about the CATMA system and how to get those, how to get the grade on your transcript with Southwestern. Or I did put my email in the chat, and I'll go ahead and put it again. You can always reach out to me and I can help you go through that process and verify if your course that you're taking at the adult school can be or will be articulated with Southwestern College. So essentially you take those courses, and then if it is articulated, you can just check it off, you know, from the sequence that you have to take to do the medical assisting building. Perfect. Any additional questions? We have 2 pages, so I need to move to see if I see any hands up. Okay, I don't see any hands up. I don't see any additional questions in the chat here. Professor Alexander and Professor Holliday, is there anything you would like to add before we close up here?
Well, I would just like to add that I really want to thank each and every one of you for taking time out to attend this. I know you could have done anything you wanted on your Tuesday evening, but you chose to be with us, and we really do appreciate that. Thank you.
And we do appreciate it. And Velma and Pam and I work closely together. We're about success, not failure. So we really do appreciate you, particularly this group of students. They're just wonderful to have in our classes. So we really have appreciated you through the semesters. And you too, Mickey, even though you were back in the day. You feel good too.
Decided to go to the East Coast on us.
Okay.
Perfect.
We
Yes.
appreciate you, Mickey. Thank you so much. I really appreciate it.
Yes, so
No, you're
again,
welcome.
thank you everyone for being here. Thank you to Professor Alexander and Holliday for putting on this presentation. A lot of great information. Thank you to our panelists, you know, for sharing your experience as a student. And Mickey, you know, you're in the field, so I think that's valuable information for our students to hear, you know, what it's like to be out in the field and that experience that you have. So I appreciate you all being here. Definitely reach out to us if you guys are interested in starting the program. Reach out. We are more than happy to assist you get started with your application and point you into the right direction for your program. So thank you again, and I hope everyone has a great evening.
Thank you.
Thank you.
Thank you all. Thank you all so much.
Thank you.
Thank you. Appreciate you.